Preliminary data from a nonpartisan study reveals a troubling but familiar trend in Indiana healthcare. It's among the most expensive in the country. But the newest data revealed an even more surprising trend. Brock Turner reports.
For cancer patients in Fort Wayne, Dr. Lakshmi Agarwal provides a glimmer of hope. She's an oncologist and part of a declining number of independent physicians. Her advice to patients concerned about high prices is do your research, but that's not easy for many of the folks she's caring for.
My patients are elderly, tired, beaten up by their cancer patients. How dare I tell my patient, look at your bill, look at what it costs you. Have the numbers gone up drastically? Ask the question why, ask for a bill breakdown. How can I even say that? So what am I supposed to advise? I don't know. I'm only inside looking at the ugliness.
Agarwal doesn't believe the state can reverse course and lower healthcare costs without significant reform.
The healthcare industry is diseased in America, and that's the problem. And we're putting big band-aids and throwing a lot of money after a diseased system. The whole system is sick.
The diagnosis largely depends on who you ask. Almost everyone interviewed agrees the problems are complicated and multifaceted. Providers like hospitals argue more transparency has lowered prices, and they're lobbying lawmakers to give them more time to find market solutions. This comes on the heels of House and Senate leadership asking healthcare stakeholders to find solutions to the high prices.
It's important to remember that the results of the RAND study are prices that have been, I would say, negotiated, but in some cases dictated by the largest insurance companies.
Insurance companies place some of that blame back on hospitals, though.
I mean, the trend continues, doesn't it? They've done numerous studies, and this is the RAND, but you've got other studies that have been cited that have consistently shown Indiana hospitals are some of the most, if not the most, in certain places, expensive in the country.
Wood's referring to the fourth iteration of a study that looks at how hospitals charge private payers for procedures. Public rates are largely set, but private rates are negotiated and often higher, in some cases a lot higher. Gloria Sachdev with the Indiana Employers Forum says that's only part of the problem here, however.
We're fourth highest in the country for hospital prices and fourth lowest in the country for physician payment. So we really have two problems.
According to study authors, it's been that way for a long time.
So in several rounds, we found that prices in Indiana are higher than both the national average and higher than neighboring states.
The same preliminary data from RAND, a nonpartisan, nonprofit think tank that's compared procedure costs across state lines, found Indiana physicians make up comparatively less than in other states. The Indiana Hospital Association doesn't believe that, or other issues, or because of a lack of competition.
So it's a really competitive market here, and that's true of other markets in the state as well. But we do have a very large insurer that is the dominant player, Anthem.
But the study author, Chris Whaley, isn't convinced.
So we know that many hospital and other provider markets in the state of Indiana are relatively concentrated and dominated by large systems relative to what we see elsewhere in the country.
So it's a lack of competition among the actual hospital systems themselves.
That's certainly one contributing factor.
The physician share of those high prices is lower than in other states. According to data from the American Medical Association, the national share of independent physicians declined 5 percentage points in 2020, the largest drop ever, and the first time it's below 50% since the survey began in 2012. Back in Fort Wayne, Dr. Agarwal has no plans to stop fighting. She's trying to rally other physicians to get together, and while she admits her administrative costs to run her practice continue to skyrocket, she has no plans to shut her doors. It's the patients that keep her coming back. While many physicians stop doing hospital rounds as they get older, Agarwal exclusively does them now because it gives them more time with the people who need her the most.
Has the human body changed in 50 years? I don't think so. So what's the problem? I don't know. We're a capitalistic country. We'll make money off of anything, even human beings.
For Indiana News Desk, I'm Brock Turner.